I am Clarice Warner. I am the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. I need to introduce my wonderful, illustrious, always consistent, always on time, there in a pinch, my sounding board, all of the things, Mr. Jesse, the registered trademark, the coding nurse. So, sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I've been in LPN for a good number of years. I switched over into medical coding in 2014. And during the pandemic, I created the Coding Nurse LLC, where I help other nurses and other people with clinical healthcare experience transition into the world of HIM.
Yes, somebody wants to come to the stage. So let me.
Okay.
Welcome, MT.
Hello. I'm a nurse as well, and I'm very curious, especially Jesse, to hear your perspective. But you guys had mentioned these certifications, and the questions that I had is like, what's the big difference between the two? Not just like inpatient and outpatient, but like as in terms of like the quality of the work that one has to do, as well as the income potential. I'm curious about that.
As far as the quality of work, they're all have professionalism and ethics around all of them. And so making sure that you meet that level should always be the goal and the aim. It really depends. The various certification depends on the specialty area in which you want to work. Like, and not just outpatient, inpatient, but like CDI, which is the clinical documentation integrity. And so the role and the functions of that position and credential is different from just a I won't say a regular everyday coder, but I mean a regular everyday coder, because there are more things that there's a higher level knowledge base that you must have in order to complete that task. Oftentimes, people come from either coding or nursing to get in that because they understand the clinical pieces behind that. It's very, very, it's much more clinical than your coding credential. You're living and breathing into that documentation to find those clinical indicators and parameters to assist in validating, if you will, the documentation from the provider and the diagnosis and or procedures that the provider did. So oftentimes coding and in you all cases, nursing is kind of the stepping stone to get into that part of it. You have compliance credentials that come out of AHIMA. You have compliance credentials that come out of other organizations, again, built on wherever it is you're landing in health information. So just health information in general have different pathways that you can go through. And depending on the pathway that you follow, usually there's a credential at the end of that. And so if you like IT, if you like the privacy and security, there are credentials around those things. Just making sure you know what it is that you have a passion for or that you're interested in, and then following that pathway, and then understanding what's required for that credential, and making sure that you have those things tied up in a nice little bow in order to get that credential.
That was very well said. And I think that the only thing I would add to it is, like Clarice was saying, you have to know what it is you want to get into, because it's not like nursing, whereas in nursing, you might be in med surg, but you might be pulled to a cardiac floor just for a shift. Then you go back to your floor, even though cardiology is different than working in your regular, ICU unit. There's still a lot of overlap. But in HIM, there are some areas where there's no overlap. There's some, but it's very highly specialized. So for instance, if you want to go into CDI, you have to know coding, but you don't have to be a coder. But you need to know how to code. You need to know the coding guidelines. You also need to know you have to think differently than just a regular production coder. because your job is very specialized. You're trying to connect the dots. You're trying to improve documentation. You're trying to tie up all loose ends. You're trying to make sure that at the end of the day, you're never supposed to make it about money, but at the end of the day, it's about so your hospital can keep all their money, and your case mix index is reflective of what is actually going on in the hospital. And if you wanted to go into CDI, if you like data analytics, if you like programming, if you like she said, IT, if you want to go into privacy and security, and all of these areas, you have the potential to make six figures without any hesitation. So I hope that answered your question.
Yes, and I also have another question. What would be a good like entry position, like in what area would be a good entry position to get one's feet wet? I mean, I'm assuming we need the or you guys mentioned we need the certification in order to do the job, of course. But after obtaining the certification, what would be a good entry level position to just kind of experience it so that we kind of even get a better idea of how the other certifications or specialties would be like?
It depends on your certification. Like you can't if you have a CDI, if you get a CDIP credential, you can't compare that to healthcare privacy and security because it's not the same. It's totally different areas of responsibility. Or you couldn't compare that to auditing because it's not auditing. Auditing, they're very specialized skills. I'll let you come in, Clarice.
So, MT, is there a specific area that interests you?
CDI, because I heard that six-figure mark, but not necessarily because I really don't know much about coding at all. So I just entered this room so that I can learn and just hear from your other brains exactly what it's about.
Well, you can get six figures and I'll use your term, and thank you, Mr. Jesse, for the production coder. You can get six figures there as well. So there are opportunities all around in all of those areas. Again, I would just recommend that. Good morning, Dr. Lisa. I would recommend that you kind of just do some self-reflection and determine, because then you're going to be chasing paper, and this is not a chase paper type of profession. You build, so you start with the foundation. So if it's coding, if it's compliance, if whatever it is, you start with that foundation and you build upon that. And as you build, of course, the paper comes, but you're not necessarily chasing the paper. You're chasing the information to get you to the higher level in which the higher paper comes, if that makes sense at all. If you're chasing the paper, if you will, it's like it's like the carrot and the stick. I mean, it's like it's like somebody with ADHD and I don't mean to mention, belittle anybody with ADHD, but you know how you shift all the time. Like, oh, I'm doing this. Oh, wait, this is here. Oh, wait, this is here. It's too much because this is a lifelong learning profession. It's too much to have to absorb. It's too much to have to manage and maintain in order to do that. So you really want to find like the area that you're passionate about, the area that you really want to learn more about and be comfortable with, not only learning more, but the change that happens in our profession. In all of those areas, there are changes that happen all the time, which could frustrate a lot of people. But if you're passionate about it, if it's something that you want to do, the change, the change is coming, and it won't bother you as much, but you'll either be proactive or reactive. And if you're passionate about it, 9 times out of 10, you're going to be more proactive. And so you're looking to see where the changes could potentially come versus trying to chase it. Again, if you're chasing the money or chasing the paper, I don't think that's the appropriate approach to go. For me, go ahead, Mr. Justin.
I wanted to echo that same point because we talked earlier about data analytics, and I was like, I was saying that I really wished I liked it a lot more than I actually did or do. because what made me first think about it is I had an agency contract as an auditor. And I was telling my recruiter that I was thinking about getting into data analytics. And he was like, oh, well, if you, can get into it, I can easily get you $70 an hour on a contract. Now that's some pretty good money. I'm like, oh, wow. But then, like, Clarice said, you can't chase paper. You have to, it's about a skill. Is this something you like to do? Because you have to master it. And you only master it by putting time in. And if you don't like it, you're not going to put the time in. And I really realized when I started looking into it and tried to study, I'm like, this is not me. So I found that I like CDI a lot better. And even though, you can get CDI contracts, they're not like, I'm not going to say that you can get $70, but that's really not like typical, but it's not too far from it. But you can still make a decent living, is what I'm saying. And you want to be happy. You want to be satisfied with whatever it is you do for 8+ hours a day, 5 days a week.
Completely understood. And yeah, I know I mentioned the 6 figures, and I'm not a paper chaser. But I have come to this period in my life in which I understand whatever work, because I don't believe in working harder than I have to, but I will work hard. But from what you guys are explaining, it's definitely about a passion more than it is about chasing money. And I'm not a chasing money, but how do we find out, which of these certifications we are like? I want to know, how can we find out more about this job? Like, before I went into nursing, I wish I knew more what like nursing was actually about. So are there any resources that you can recommend that would kind of give an insight into more about what each job entails?
Absolutely. I think that you first start by going to the sources. So you can go to ahima.org and you can go to aapc.com. Those two websites, because those are the two titans in the industry, they will give you all the information you need to know about about each credential, what it entails, what you need to know, and what kind of um, employment opportunities you can have as a result of obtaining that credential. Then what you also want to do is you also want to do your due diligence, and you want to go to, I always tell everybody, go to Indeed and just put in the credential that you're interested in and see what comes up in terms of opportunity, see what comes up in terms of job description and even money. And then once you are satisfied, then find a program that will help you achieve your goals.
Understood. Thank you very much for this information.
You're welcome. Glad we were able to assist. Thank you all for joining us. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care.